Jehovah Gemereki Amarambe Onuru Oli Timbugi Ewo Akajuwa Gemereki Amarambe Onuru Oli Timbugi. I welcome everybody. Good morning, good afternoon, good evening, depending on your time zone or anywhere you are joining or watching this program from. If it's your first time, you are welcome. I welcome all of you, and I want to seize this opportunity to appreciate each and every one of you. In fact, each time I go through your comment about my father's passing away, I feel like crying, knowing that there are people out there who care for you, people who will stand for you in times of trouble, people who loves you. I really appreciate your condolence messages, and I say may God Almighty bless you all. Anybody that consoled me during this period, this year will not pass you by. Even those that do not, this year will not pass you by. The God that I serve, the living God, the Almighty, the creator of the universe, the I am that I am, the beginning and the end, the author and the finisher of our faith, the God that knows our mind before we speak, will answer your prayers. God will wipe away your tears. God will wipe away any spirit of infertility in you. And this reminds me, very soon we are going to start our prayers. It's raining. If I show you testimonies that I have, people that are pregnant, you wouldn't believe it, honestly speaking. So I appreciate each and every one of you. I appreciate your messages. I appreciate it. May God Almighty bless you all. At least now I know that if mosquito bites me, I have people that can fight for me. Yes, thank you all. If you are joining me, please share, invite your friends, because the topic I want to talk about today, I think, is very, very important. A lot of women are passing through this, and I want to say something. If you like my program, if you like what I'm doing, please, you can subscribe to this page to support me. People in Nigeria, I wouldn't tell you to bother yourself. Do not. Because somebody said she wanted to subscribe. They were asking her ATM. I don't know how it functions. But if you're in a European country, €4, €5 will not cost you anything. Very soon, we are going to be using this platform. So the way I'm using it to help to educate women about fertility. We are also going to use this platform to extend the hands of help. There are many women out there that are pregnant. They don't even have money to eat healthy food, and they don't even have money to go to the hospital. They don't even have money to buy prenatal vitamins. We are going to be reaching out to these people. This is the main purpose of this platform, to help people. It's not everything. Some people are attacking me. Why are you not collecting money? Other people who are doing this, they are collecting money. Everything is not all about money. You need to do something that will impact life, right? That is what I want to do. I want to do something that the day I will leave this world, if God asks me, in what way did you help people, I will say, yes, God, I help to educate women who are trying to conceive. So please, if you can support by subscribing, we are going to be extending help to people who do not have money to buy prenatal vitamins. People who, some women are pregnant, they don't even know what they are carrying. They don't know if their babies are healthy. In fact, God is in Africa. God is protecting. So this is what we are going to do. And if you are still doubting my teachings, I posted there's a pregnancy test somebody sent to me. I posted it. Somebody was disclaiming it. She was like, the test line is only one line. Then do you think that I think this is positive? I was just laughing. Somebody that is 8 months gone. When immediately you become pregnant, HCG, your HCG will dictate it. Some people, if you use those simple, if you want to really know, if you miss your period, you want to really know that you are pregnant, I will always advise you to buy Clear Blue. All these 100, I don't know how much cheap tests. Sometimes you may be pregnant. When you conduct the test, it will be negative. I think I have said it before. Don't throw it away immediately. Keep it. If you did it in the morning and maybe it will not be clear, because it's just maybe some days past implantation, so you don't expect it to be clear. If you really want to see the actual result, then go and buy Clear Blue pregnancy test. That one will show it's clear, because it's dictated 4 days, 2 days past. But you see all these small tests, before you can see them clear, if you do it in the morning, if you suspect, or maybe you miss your period, or maybe you observe when implantation have taken place, what you can do it in the morning, even if you show you negative immediately, because that is exactly what is going to happen. Just dump it somewhere, and maybe in the evening, go back there, you see that the 2 lines are clean. That was what happens to me in this my first pregnancy, this last pregnancy. Although I know that I was pregnant, but I just wanted to confirm it. I used those cheap one. It shows me, one line was too fainty. I just dropped it. In the evening, I went back there, and I went out to buy Clear Blue. So, but I left that one there when I tested with Clear Blue. And one thing I like about Clear Blue, you can use it at any time. So you don't need to wait for the other one, like your first urine. So when I came back in the evening, I checked it, it became clear. So somebody asked the question if she can become pregnant with fibroid. And I said yes. Somebody was disputing me. Before you can dispute me, or before you can, challenge me, please always go and make research. I am not guessing. I am not guessing what I'm saying here. Whatever that I'm teaching here is real. I study it very well. If it is a remedy, before I present it to you, I have, tested it. I am not talking all the way. I'm not talking blah, 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 blah. Whatever I said is here. I have studied it. Somebody said, no, how can that happen? I just laughed. Every woman, including myself, have fibroid. Fibroid is a tumor that is not cancerous. Every woman has it. If you don't have fibroid, it means that you cannot give birth, because it's a sign that you are still under the stage of reproduction. Once you enter menopause, you will not have fibroid again. Some people do not understand. So every woman, the reason why you think you don't have it is because it's not giving you a sign, because you don't have submucosal fibroid that disturb people to become pregnant. So I believe that person that is challenging me, next time go and study very well before you come here to challenge me. You think every woman, if they tell you have fibroid, you think you cannot get pregnant. Fibroid cannot stop you from becoming pregnant, except submucosal uterine fibroid. This one is lying in the lining of your uterus, where the fertilized zygote is supposed to be. and it will not even prevent you to become pregnant. The way it affects you is that if the egg is fertilized, when the baby want to go and implant, this fibroid is already sitting down there. They will be dragging each other, or sometimes it will make you to have a very severe pains. It will lead to miscarriages. Sometimes, if you have this submucosal fibroid, it can distort your system. If you haven't watched the videos of food that you are to eat, please go and watch it. I made out the video today. It was very horrible for me today because my baby was disturbing. I said I must make this video today. Yesterday was my father's burial. Go and watch. Try to avoid. And yes, somebody was telling me it's a lie. This they said what is this adage? When you are not informed, you'll be deformed. I talked about the food that you are to eat. Somebody was telling me, I mentioned the yam. Somebody said it's a lie, oh. Even yam, when you eat it, you become pregnant. That is a myth. There has not been any research, concluded research that claim or that explain that yam can help you to ovulate. That is a myth, a myth, a myth. It is not in realistic. There is no research that have proven yam to be source of ovulation. So before you dispute me, please try to make research. Before you come and challenge me, go and make research. Anything that I'm teaching you, go to search engine, is there. I'm not here to how will I say it? I'm not here to deceive you. So whatever you see me talking, I am very, very sure of it. So I think I have cleared myself. Yes, somebody again wrote, she said, hey, people, a man said, you always talk about women. What about men? I said, why? And I said, every video that I'm making is for both men and female. I always talk about sperm count, low sperm count and motility. I always talk about it, even most of my reels. That is what I do. Another person say you say you are helping women by not responding to their question, and I want to beg each and every one of us, if you know the answer to the question, please try to reply, try to answer, because it's too much for me. Imagine me I have a new baby, I have other children, my husband is there, I have a lot of things. I just managed to create that time to make this video. If I did not answer, if you know the answer, please help me to answer. Sometimes that's why I create live videos like this. I entertain questions. If you are not joining the live video, then it could be your problem. So let's get into today's video. Please try to subscribe to this page to encourage me, and also so that we can help others. If you haven't watched the video I posted about foods that you can eat that you should avoid, because this issue of hormonal imbalance is your food, though. It's what you are eating. It's what you are eating. When you eat healthy food, you wouldn't have any health issue. Your body will have normal alkaline body. Your body will become alkaline, will be able to fight against any infection. But when you are prone to all these foods, then your body will become too acidic. Even your vagina will be acidic, that will be killing the sperm. So try, and you might not, I'm not saying that you should avoid those food totally, but limit, especially soda. Sugar is some people that are suffering from hyperprolactin is as a result of high blood sugar. Once your high blood sugar is high, it will now go and increase your prolactin level. So let's get into this today's topic. This is my notes for people that will come. This is sometimes when you sleep, I am awake making research. Thank you. Somebody will tell me that I claim to have. You are not paying. I have started attacking me that I'm not collecting money, and if this type of thing continues, maybe I will start collecting the money, because our people always like to learn in a hard way. Try to be you guys should try to pamper me so that I don't change my mind. So today's topic, ovarian cyst. Ovarian cyst. What is ovarian cyst? A lot of people have it. Sometimes they say that I have cyst. Now I want to show you what ovarian cyst is and the one that can affect your ability to conceive. Now, what is ovarian cyst? Cyst simply means a fluid. Are you people ready? I would like you people to get your pen and paper so that you write this thing down, because some people will say my doctor told me I have cyst, and I always tell people, when you are diagnosed with cyst or fibroid, ask them the size, the position. So this is so that you will know the one that you have before you start killing yourself, because immediately they tell you have fibroid, you say, oh, my honor is finished, I cannot become pregnant again. You have to know the type of fibroid or the type of cyst you have. Cyst simply means a fluid-filled sac. The second word is ovarian. Every woman have 2 ovaries, and this ovarian is gotten from the word ovaries. Every woman have 2 ovaries, and these are 2 almond organ that is formed in a female reproductive organ. So when there is a fluid in a sac, we say ovarian cysts have taken place. Ovarian cyst is a fluid sac in your ovary. So whenever you go for a scan, sometimes it always happens to women that are not ovulating. So in every month, that fluid-filled sac supposed to be your follicle. So when this follicle did not release, it will be there. So when you go for an ultrasound, the doctor will see it. They will tell you it's cyst. Now, when you have been diagnosed, please try as much as you can. Since you are watching me, you should be able to know that there are many types of cysts. There are the ones that are harmful and there are the ones that are not harmful. Try and ask your doctor what type of cyst. If you have been diagnosed with fibroid, sometimes they call it myomas. Ask them the type of fibroid you have and also the position, the size. These things matters. So when there is a fluid sac in the ovary, then you can say that ovarian cysts have taken place, and the ovary of a lady tends to release egg every month, and these ovaries release hormone known as estrogen and progesterone. These two are the major function of the ovary. So when there is sac on this ovary, we say ovarian cysts have taken place. 2 hormones that are responsible for this ovary to function properly is estrogen and progesterone. Remember, I always say that progesterone thickening the lining of your uterus. So when there is this sac, just like when you bring water, you pour water inside nylon, very white nylon. If you check the nylon, you see how this nylon, that is how exactly how the ovarian cysts look like. Now we are going to look at the types of ovarian cysts. From here now, you will know the one that is harmful or the one that the doctor will diagnose you of. You will now know whether it is going to affect your fertility or not. We have 1, functional ovarian cyst. This happens during your menstruation. It's a normal thing. It's not painful. It comes and goes. It's harmless. Functional cyst. After your menstruation, this is when this functional cyst will start to develop. They will be developing until after ovulation. If they did not mature for release, then within 3 cycles they will go on their own. They are not painful. They will not pain you. But if you go for an ultrasound within this period, the scan will see it, but it is not painful. It's not harmful. There's nothing to worry about this type of cyst. Now, number 2, we have pathological ovarian cyst. This type of cyst is a result of hormonal abnormal cells. This one happens as a result of abnormal cells. And what can cause abnormal cells? Hormonal imbalance. The one that is their grandfather that is disturbing very well is called diamond cyst. This is the one that you should be worried about. Whenever your doctor tells you that you have what is called diamond cyst, then you should be worried. This cyst consists of various tissue types in your body. This is from ovary in your body. They are comprises of inside this cyst. Remember, the normal ovarian cyst is just a sac fluid, a fluid sac in your ovary. But this particular diamond cyst, you will see hair, you will see teeth, and you will see skin. They develop from the reproductive cells in your body. This is the one that you should be afraid of. This is the one that can prevent you from becoming pregnant. This is the one that makes your menstruation to be heavy, painful. This is the one that needs surgery. No matter what you treat with, there is no natural remedy that can cure this. It is only surgery. I have seen when this type of cyst was removed from somebody's body. If you see it, how? So diamond cyst is the one for people who always say I have ovarian cyst. Please try to find out the types of cyst you have. If it is formular cyst, if it is follicular, there's one they call follicular cyst. If it is pathological cyst, it's also not good because it's come from abnormal cells, but it's not painful like the one of diamond. Diamond is very, very painful. Comprises hair, teeth, and the skin. When they bring it, if you look at it, you might not eat. So now let's find out what is the causes. I hope you are right. You see my pen. I hope you guys are with your pen, because after this thing, I'm not going to treat this topic again. Now, what are the causes of this ovarian cyst? What causes this ovarian cyst? Number one is hormonal imbalances. Hormonal imbalances is just like the foundation of any problem. Once your hormones are not balanced, you will start having many problems, many issues, many problems. Anything will affect you. But when your hormones are strong, they will be able, your hormones supposed to be fighting, your hormones supposed to be soldiers in your body. When all of them is okay, whatever that comes, they will kick it away. They will be doing like this. But when your hormones are weak, whichever problem that comes, your hormones will be like this. Have you seen where somebody that is that how will I put it now? Have you seen somebody that is weak? You can do the person anything, right? But if you are agile, when somebody come, you knock the person like this. Strong hormones, that is what they do. But weak hormones cannot do anything. Those things will just be occupying. So the number one causes of ovarian cyst is hormonal imbalances. The second one is endometriosis. This simply means uterine tissue, what is supposed to be in the uterus, is growing outside the womb. So endometriosis can cause ovarian cyst. And I have explained what endometriosis is. Endometriosis is a situation whereby the tissue that's supposed to grow inside your uterus, they come outside to grow. So when this endometriosis grows outside your uterus, it will now possibly form a cyst. So the number two causes of, please, if there's anything you didn't explain, I'm here teaching. Some people are just asking questions. If you are just joining me, you don't know the rules. If I am teaching, you keep quiet, you watch, you listen. After this, and if I have time, I may entertain question. Whatever you are writing here now, you just like you are writing to yourself, because I'm not seeing it. I'm not going to read it. When I finish, I will give room. If I have opportunity, I will give room for questions. So we are teaching ovarian cysts. Instead of you to cool down and listen, you are here asking me, can you get pregnant after you shrink fibroid? Please, I believe everybody watching me here is an adult. Let's learn how to comport and respect ourselves. I know that there are many new people here. That's why I'm repeating it. If you come, always come with your paper and pen. At least before I finish, even if I'm talking nonsense, you can grab one or two things. At least when you are told that you have so thing, you know whether if you should be worried or not. So it's very, very important to always pay attention. If I give room for question, you answer. And if you are joining me, please help me to like, share. After this video now, you see 60 people watching. After the program, you will see only 20 share. God is watching you. God is watching you. I am a daughter of God. So whenever you do me a favor, God will do you a favor. Whenever you do me a favor, God will do you a favor. The way I defeat people, the way I defeat the Satan, the enemies, those who consider themselves to be my enemy. I don't have enemy. I don't have women being as enemy. My enemy is Satan, the enemy of God. But if you consider yourself my enemy, the way I defeat you is by keeping my hands, my heart clean. My heart is just like this. My hands are clean. So that is the best way to defeat the enemies, by doing good. No matter how they try to hurt you, keep on doing good. Conquer them with goodness. They will be ashamed of themselves and they will run away. Even when they think that you are going to fall, that you keep on, like some people now, some of us watching, there are people who are rejoicing that you are not getting pregnant. There are people who derive joy in seeing you shedding tears every day. There are people who derive joy in seeing you in your present predicament. There are people who want you to remain like that. And these people, they are not far. There are people beside you, those ones you call your friends. They don't want to see your progress. They don't want you to become pregnant. Anytime you are progressing, they will be angry. But at the same time, they will be laughing with you. And you'll be telling them, learn how to be secretive. No, some people who claim they know me, they don't know me. I allow you to know the only side of me that I want you to know. If you don't know me, try to learn how to keep some things secret, especially those people harboring around you. They are there for three purposes: either to get information that they will use to fight against you, or they are there to worsen your situation, or maybe they are there because of the favor that they are getting from you. Anytime you cease to do that thing, they will disappear. So be wise. Number 2, I said endometriosis, and I have explained that endometriosis simply means uterine tissue. What is supposed to be in the uterus is growing outside the womb. So endometriosis can cause ovarian cysts. Another one that can cause ovarian cysts is pregnancy. Some cysts can occur during the early stage of pregnancy and they will also go away. This doesn't have a problem. Another thing that can cause ovarian cysts is a severe infection. When you have that is why I keep on telling people, if you have infection, please try as much as you can. That is why every 6 months, every woman is supposed to be going for checkup to check your ovary. Here in Europe is common, but in Africa, I don't know. I have asked before why people do not, go to hospital. When you tell them to go to hospital, they think it's I don't know. Can somebody please later, when I will be asking questions, tell me why we don't go to hospital in Africa? Some people might be suffering from infection, and before the infection will be detected, it have done a lot of damages, either blocking the tubes, causing fibroid, causing cysts. Why? But if it is here every 6 months, that is why you see the whites, they live long, because they check their body. Any sickness that they are developing, it will be detected early and it will be fixed. So severe infection can cause ovarian cysts. That travel to the uterus, fallopian tubes, can result to ovarian cysts. So this severe infection can block the fallopian tube and it will lead to cysts. Now let's look at the signs. I hope you people are typing it. Let's look at the signs and symptoms of this ovarian cyst. How would you know if you have ovarian cyst? What are those things that will be happening to you, to your body, to your womb, and you know that, oh, this could be ovarian cyst? Number one, pelvic pain. Pelvic pain. When there is pelvic pain in the pelvic, when you have pelvic pain in the pelvic region, it can be signs that the person has ovarian cyst. Whenever you are feeling pelvic pain in your pelvis, it could be signs of cyst. Another one is pains during sex. When you have pains when you are baby dancing, it could be sign of ovarian cyst as well as fibroid. Another one is frequency in Another one is frequency or pain when you are peeing or when you are going to toilet. You feel pain. It could be signs of ovarian cyst. Another one is difficulty in emptying your stomach. Maybe when you want to go to toilet, if you are pooing, it will be very difficult. It will be very painful. Another sign is irregular period. When your period are not regular, it is a sign of cyst, especially that of diamond cyst. Diamond cyst is very, very bad, or pathological cyst. These are the ones that I know that can seriously affect women. Difficulty. Another sign of cyst is difficulty becoming or getting pregnant. Ovarian cyst can affect one or two ovaries. So if you are finding it difficult, try, like I said before, try to, before you start killing yourself or bothering, if this cyst can affect me, can prevent me from becoming pregnant, try to find out the type of cyst that you have. So somebody may ask, does cyst have treatment? Somebody may say, does cyst have treatment? We are going to look at if cyst can be treated. Before we continue, do you people understand what I am saying? If you understand, please you say yes. Let me see somebody write yes before I proceed. I don't know. My Dutch is spoiling my English. I'm just managing with English. Do you understand? Please, if you understand what I'm saying, you say yes, so that I will continue. Let it not be like I'm talking to myself. I'm waiting for your response. Okay, one person said yes. Okay, we are going to continue. Thank God that you people are understanding, because if there's something in communication that they always say, encoder and the decoder. I am the encoder. If you are not decoding it, it's just that I'm making noise. So for communication, effective communication to take place, both the encoder and the decoder will understand themselves perfectly, and I am happy that you people are understanding. And I want to beg you for one thing, please always write something down. Write something down, so that if somebody asks you, or maybe even in the comment question section of this video, people who are not here, they will always come, and some of them will come, they will not watch the video, they will start repeating or asking me what I have said already. It makes me to be angry. So if you see such question and you are here, you can also help me to answer it. We all are teachers. So does this cyst have a treatment? Now, the treatment depends on the factors such as the size, like I said before, location, symptom you are having, and what is actually causing the ovarian cyst. For example, if it is an infection that is causing the ovarian cyst, bacterial infection, your doctor may give you antibiotics. Some may be treated with hormone replacement drug. Some may require surgery. For example, if you have something like pathological cyst, which is abnormality in your cells, then in this case you might be giving some medication. If you have a formula cyst, that one doesn't need any medication. It's just within 3 seconds it will go. But you see diamond cyst, when you have diamond cyst, there is no other way, or it needs surgery, because those teeth, hair and skin need to be removed. And this is all about cyst. Now we answer question. If you are here, you experience any of these things that I am mentioning, please, I will advise you to go back to your gynecologist, healthcare provider. Let him use ultrasound. Now then, you need to ask question. Now I am enlightening you. If you go and he said you have cysts, please ask him, what type of cysts do I have? Even if it is here, when you go, if they see cysts, they will tell you have cysts, and within some months it will go. But some people there, they will just tell you have cysts, and you become afraid because you think if you have cysts, you cannot become pregnant. Even like fibroid, some people, they said you have uterine fibroid, they'll say, oh, I'm finished, I cannot. It's just like some people think that when they go for fibroid surgery, they cannot become pregnant again. Like I always say, even if you have cysts, apart from diamond cysts can only be removed or cured by surgery. But other minor cysts, if you stop feeding them with estrogen food, or there is some little things that you can do that will help them to go, but not diamond. It's just like somebody who have a submucosal fibroid. Is the same thing. It's very big, submucosal fibroid, and the position where it is need to be operated. Or the best way to cure fibroid is you stop eating the food that is rich in promoting the growth of estrogen. Then you will see that the fibroid will start dying, shrinking. Then you become pregnant. I will take only 5 questions. It's just 9 o'clock. I need to go and tend to the children. They are still awake. Just 5 questions. Please let us go. If there's anything I say that you don't understand, I give you opportunity to ask questions now. Please ask question. If there's no question, then we'll call it a day. Please ask question. If you are coming, like this video. If you haven't followed our page, please follow our page. If you have not subscribed, try to subscribe. If you like what I'm doing, the subscription is not by force. It's if it touches your heart. If you like what I'm doing, it touches your heart, you want to support, please support. It's not by force. Please, I am not talking about fibroid. I want the question to base on what I'm teaching. I am not talking about fibroid. How to balance. Please ask me questions based on what I'm teaching, so that you don't confuse me. Let me take another phone to be reading the question. How to balance progesterone and estrogen in order to conceive. You need to go to your doctor. This progesterone is a hormone, estrogen is a hormone, so they need hormone replacement drug. Not here. Go and meet your doctor. If both of them are not balanced, you cannot become pregnant. I am telling you the truth. Estrogen is supposed to thicken. You hear me? I don't know if you come early. Progesterone and estrogen, they are the main hormones that is in charge of your ovary. So if any of them have problem, you are going to have problem when it comes for conception. Can it be possible to have cyst and no symptom? Of course, if it is not big, he will not have symptom. If it is a formula cyst, it is harmless. The only cyst that gives problem is diamond and the pathological cyst. Can one get pregnant after shrinking? Of course, of course. If the fibroid is shrink, then you can become pregnant. That is, if you have uterine fibroid, example, submucosa. Then if it is shrink, which means what is stopping you is over, then you become pregnant. That the answer is straightforward. Can uterine fibroid, that is 16, hinder pregnancy? Yes, it's big. It's big. You need to work hard to reduce it. What about somebody that have blocked tube? Every woman have two tubes, two fallopian tubes. If one is blocked, you are going to conceive with the other one. But in a situation that the two tubes are blocked, I am going to tell you nothing but the truth. There is no how you can get pregnant except by miracle, naturally. But through assisted reproductive such as IVF, you can become pregnant. But naturally, tubes, fallopian tubes is just a place where the egg and where the sperm passes to meet the egg. So if it is blocked, there is no how the sperm can swim. So if two of them, I mean to say, but if one is open, you can conceive it. Just like somebody who have one eyes, you can see with this one, right? But you know that it's not the same like when you have two. That is how it happens in fallopian tube. If this one is blocked, you can still get pregnant with this one. But if two of them are blocked like this, naturally conception is not for you. Good evening. What is okay? Good evening. Please, what are food that can go and watch the video? I have made the video. You can also as well make research of. I have made several videos about food that shrink fibroid. Go and watch it. I don't know, maybe if it is your first time, please go to my page. It's there. What can cause severe pain at the right side of the lower? I don't know. You go and check. Go and make tests. I'm not a spirit. I'm not in your body. It could be this cyst, it could be fibroid, it could be endometriosis, it could be PCOS. There are many things that can cause all these things. So how will I tell you it's this one now? You have to, whenever you feel something unusual in your body, please go. That's why if I see people that write such thing like this, I don't reply because I don't know. Now, please, what type of food that someone that has ovarian endometriosis? Go and watch the video. I have made the video. What about cysts? I said it's also disturbed, but not as severe as diamond cysts. It's been good for fiber. Very good. This is not good. How can you know if uterine fibroid has shrunk? Hey, I will not be answering this question. Please, if you are typing question, ask me reasonable question. How you can know if it shrink? You used to have the symptoms, right? You used to feel pains. You used to see heavy bleeding. There is abnormalities when you have these things. So how will you know? The best way is to go back to scan. But if you don't want to go back to the scan, the signs that you used to feel before, when you stop feeling them, you know that the fibroid have shrunk. Can one be pregnant after 10 years? Anyone can become pregnant when you start doing the right thing that you have not been doing. Of course, you can become pregnant. Can I get pregnant with right ovarian cysts? What does that mean? I don't understand your question. Good afternoon, ma, from US. You made mention of the food that someone with fibroid can be eating. Please, in which of your video? My dear, this is homework. Oh. This is homework. You need to go and search for it. But if I have time, anytime I see it, I will share it, or maybe I can redo the video. I think last month I made several videos about fibroid food, or maybe next week I will make the video again. But trust me, I've made several videos about it. Can someone who is having polycystic ovarian syndrome, yeah, you can get pregnant, but you must work. Polycystic ovarian syndrome, PCOS, is a very severe fertility challenge. This is somebody who have PCOS. This is somebody who have endometriosis. This is somebody who have hormonal disorder. This is somebody who have Diamond cyst, this is somebody who have submucosal uterine fibroid. Very, very difficult for them to get pregnant if they do not work very hard. Yes, you can become pregnant with PCOS if you work very hard, especially in the area of changing your diet. There are specific diets for PCOS patients. You might go and search for the diet. Try to reduce weight. What is PCOS? It's the something like cyst. It's a fluid-filled sac in your ovaries. And again, is when a woman starts having many of male hormone called androgen. This is, you are a woman, physically you look like a woman, but all your hormones, your body looks like a man's body. You see some women, they have hair in their chest, all over the places that men supposed to have. They have pimple, acne, they have what do you call it, oily face. They are too fat. These are the signs and symptoms of PCOS. Sorry, can someone with right ovarian cysts? So I think I have tried. Thank you so much. Thank you so much. Anytime I have chance, I will be coming live like this. So now that you have known what ovarian cyst is all about, if you have it, maybe you go back to your doctor and try to find out if the type of cyst you have, so that you will not be afraid of yourself, so that you will not be worried. And if you are diagnosed, there is nothing that doesn't have solution. Everything has solution. It's just for us to work on it. So thank you so much for being here. Thank you so much for sharing. If you forget to share this video, I am reminding you now, in your way out, share this video. Share it to that your friends. Share it to that platform or group you belong to. Share it, watch it. You can watch it over and over, even if you are coming now, even if you are going to watch it later. Watch it. If you didn't understand me, maybe when you sit down, you listen to it and you learn, so that you can teach others. If you haven't followed our page, try to follow it. If you haven't subscribed to our page, try to subscribe, and God will bless you. I love you all, and I also want to appreciate each and every one of you who consoled me in the passing away of my daddy, who was buried yesterday. I really appreciate, and I pray that God Almighty, the way you console me, God is going to console you by making you to become pregnant. This year, it will not pass. This year, you will carry your baby. You become Mama Bomboy. You become Mama Ada. You become Mama of that person that you want to be the mother to. So, I love you all. Bye-bye and good night.